Welcome back to my YouTube channel, and today I am here specifically for girls because I am a girl and I know what girls go through every time they receive their monthly periods. Others feel like they are shy, they don't even want to go, others feel a lot of pain. So I am here specifically for that. We have a lot of menstruation disorders, and here are some of them. I'm not going to finish everything, but I'm just going to give you some part. So if you are experiencing some disorder, if you are getting any problem with your menses, you can comment below and really talk to me. What is the matter? What could be the problem? And we look for the way how to solve it. So today I am here for menstruation disorders. So we have different types of menstruation disorders. Number one, we have amenorrhea, that is absence of menses, and it can come in different types. It could be primary or it could be secondary. And primarily, this is where you delay to get your menstruation periods even when it is the right time. Let's say you are in puberty stage, but then you are not receiving menses. That is, puberty stage starts from 12 years up to 25. So you find yourself, you're not menstruating yet, you're in puberty stage, you have breasts, you have everything just like any other normal girl, but then you are not menstruating. That is primarily amenorrhea. And then for secondary amenorrhea, that one happens like you are receiving your menstruation every month, but then you skip like 4 to 6 months and it comes. So secondary amenorrhea, it comes when you've been menstruating regularly every month, but then you stop for like 2 or 3 months, or sometimes 4 to 6 months, and then that menstruation comes again. That is secondary amenorrhea, and I'm going to tell you the reason as to why some of you are experiencing such and the way you can really overcome it. Then number three, we have dysmenorrhea, that is painful menstruation periods. A lot of girls are experiencing that problem, and it is too painful. Sometimes you get a lot of cramps, like it is severe. Others do vomit, others get nauseated, others are even admitted to the hospitals. So dysmenorrhea is really bad, and for any girl with dysmenorrhea, I'm too sorry for you, but then here I am to tell you the reason as to why you have dysmenorrhea and the way you can really. So number three is dysmenorrhea. Dysmenorrhea itself means painful menstrual periods. It really interferes with regular activities and requires medication, because a lot get cramps that are severe, others get too much abdominal pain, the lower abdominal pain, then others get nauseated, they lose appetite, they get diarrhea, and others are just rushed to the hospitals for medication. So in case you have dysmenorrhea, I'm here for you today to know the reason as to why you have dysmenorrhea and what you can really do to take away dysmenorrhea, because a lot of girls are really suffering from this problem, and I really do not want my girls to suffer. So dysmenorrhea is treated. Don't get worried in case you have dysmenorrhea. Just comment below and tell me the type of dysmenorrhea you have. Is it severe, is it mild, or is it moderate? So menstrual disorder number four, we have menorrhagia. Menorrhagia means excessive bleeding. That is, you have excessive menstrual flow. It could be due to fibroids in the utero, or sometimes complications of pregnancy, or sometimes pelvic disorders. So it comes with some complications itself, and it can tend to last for more than 7 days to 8 days, or sometimes 11, or sometimes 14 days. But a normal menstrual period should be, at least if it is long, it should take at least 7 days. If you really use more than 3 packets of pads, then it means you have menorrhagia, and I am here to solve that problem because I'm going to tell you the medication and treatment. Number five, we have premenstrual syndrome. Premenstrual syndrome occurs It happens in cycles and affects the psychological and physical well-being of a lady, because anytime you're going to receive your menses, the brain prepares the body to receive your menses. And when you fail to get menses, it means it is going to affect you psychologically, and you get physical symptoms like breast enlargement. Sometimes you get anxiety, sometimes you get irritability, sometimes you get bloating, and in real sense, you're not even menstruating. You're not menstruating, but then you are experiencing physical symptoms of menstruation period. So if you have been experiencing one of these menstruation disorders, let it be amenorrhea, let it be menorrhagia, let it be dysmenorrhea or premenstrual syndrome, I have some medical treatment for you that will help you if you really follow the doctor's prescription, or if you really follow my guidelines, because we have a lot, and a lot of tablets have a lot of different brand names, so it depends on the amount of money you're having and kind of brand you are buying. But it is the same content, it is the same medicine, it has the same generic name, but then it has a lot of different brand names. We have tablets that can really help you solve your menstruation disorders, and here we have bromocriptine, we have mefenamic, we have norethestone, we have danfastan, but I'm just going to give you one tablet per each menstrual disorder. For example, if you have excessive bleeding, you can use norethestone for you you take it 5 milligrams twice a day for 14 up to 26 day of your menstrual cycle. I don't know if you're getting me. And or sometimes you can, if you really want to stop bleeding, I'm starting with menorrhagia, that is excessive bleeding. You are going to use a tablet known as norethestone. It weighs 5 milligrams. It is a tablet and it has different brand names like Regulate N, Primulate N, and you are going to take 5 milligrams twice a day or thrice a day, depending on the amount of blood you are losing, for 10 days. Or if you really know how to calculate your menstruation days, you are going to take 5 milligrams thrice a day, starting with your day of 19th. It is a 19th day up to 26th day of your menstruation cycle, and there you are going to solve menorrhagia, the problem of excessive bleeding. Dysmenorrhea. If you know you've been suffering from dysmenorrhea for a long time, and dysmenorrhea is painful menstruation periods, here is what you're going to take: a tablet known as dihydrogestolone. It weighs 10 milligrams, but you can get it in different brand names like dafastone. So you are supposed to take a tablet weighing 10 milligrams of dafastone twice a day, starting with the 5th to 25th day of your menstruation cycle, if you really know how to calculate your menses. And if you really do not know how to calculate it, you are going to take 10 milligrams of dafastone starting with the 11th day up to 25th day of your menstruation cycle. Maybe I'll get a time, or I'll get a day on how to teach you how to calculate your menstruation days and cycles, but not today because I have a lot. Amenorrhea. Amenorrhea is absence of menstruation periods. So if you have a problem of amenorrhea or absence of menstruation periods, you are also going to use the same treatment as we use for dysmenorrhea, known as dihydrogesterone or known as dafastone in brand names. You are going to take 10 milligrams twice a day for 11 to 25 days of your menstruation cycles. Remember, we have two different types of menstruation cycles. We have a short one and a long one. So for a short phase, it has 28 days, and for a long phase, it has 32 days. So I'm just going to get a day and teach you. I'm going to get a day and teach you really, but you are going to take that. So premenstrual syndrome, I've told you that it happens like you get psychological and physical symptoms of menstruation, and this is what you're going to do to stop that menstruation disorder. You're going to take norethistone, which weighs 5 milligrams, and it is a tablet. It has different brand names, and you are going to take 5 milligrams, one tablet, thrice a day, starting with your 19th day up to 26th day of each menstruation cycle for 7 cycles. So bromocriptine, dapastone, Regelet N or norethistone plus dihydrogesterone and a lot have side effects. For example, skin rashes, we have irritability, we have weight gain or sometimes weight loss or sometimes hot flashes, we have insomnia, we have nausea and vomiting, we have loss of appetite. So if you really experience one of these side effects, don't get afraid, but if it persists for a long time, then consult a medical doctor for medication or for treatment or for any advice. And if you really take these tablets just like the way I've told you to take them, you will surely solve the menstruation disorders and you will live a happy life as a girl. Thank you for watching. Please don't forget to comment and subscribe. Thank you for watching. Please don't forget to comment below, like my videos and subscribe if you've not subscribed.